Hello there, guys. Welcome to my brain wreck. As you know, for most of you that watch my channel, very few subscribers I have anyways, this is for information purposes only. A lot of the information I get from is epilepsy.com. So in this episode, or blog I'm talking about, is about Dravet syndrome, what it's all about, and who have it, who's had it, and why did they get it, and how's it passed down. So as I say, now I'm reading stuff over here from off the left to the screen on computer screen here. So what is Dravet syndrome? Well, Dravet syndrome is a rare genetic epileptic encephalopathy. Encephalopathy. So what is encephalopathy? What is encephalopathy? Encephalopathy is a group of conditions that cause brain dysfunction. You know, this is why I call my brain wreck. But I myself do not have that. I just have nocturnal seizures. Excuse me. Brain dysfunction can appear as confusion, memory loss, personality changes, and or coma in the most severe form. There are different types, each with different causes that range from infection, exposure to toxins, underlying condition, and more. Toxins can be a number of things, from bleach, mold, all kinds of stuff. So basically, Dravet syndrome is a rare genetic epileptic encephalopathy that gives rise to seizures that don't respond well to seizure medications. It begins in the first year of life in otherwise healthy infants. So I believe Dravet syndrome came named after a person. I can't remember exactly who, but before 1989, this syndrome was known as epilepsy with polymorphic seizures. So polymorphic epilepsy and FMC, or PEMI, or severe myoclonic epilepsy and FMC, SMEI. Disease begins in FMC and is lifelong. So unfortunately, it is lifelong, and there's really no cure for anything. You just live with throughout your life until your time comes, unfortunately. So there are some important points. Infants have normal development when seizures begin. Yet as seizures continue, most children develop some level of developmental disability. So they're going to have developmental disability, it can be delayed in certain things, by their childhood. So by later childhood, most children also develop a crouched walk. So they're going to be crouched and walking over. So that's a sign to look out for, possibly, for Dravet syndrome. That could be a number of things too. There's other things that have crouched walks and stuff like that. Maybe people with cerebral palsy also, sometimes they have like a crouched walk, possibly, You just never know. Usually people with cerebral palsy have something with their hands and things like that. So diagnosis is often delayed, unfortunately. So MRI and the EEG tests are usually normal in infants at first. So they look normal and stuff, and everything is fine, everything, So other than that, we just don't know exactly. And just for information, I'm not a doctor or anything like this. This is for information purposes only. If you need to consult your doctor, consult your medical team, professionals, neurologist, doctor, whoever that you talk to. So about 8 out of 10 people with this syndrome have a gene mutation. So there's a gene mutation in SCN1A. Don't ask me what that means because I have no idea. That causes problems in the way ion channels in the brain work. This mutation is often not inherited from the parents. It's considered a de novo or new mutation in the child. Not all SN1A mutations associated with Dravet syndrome. So somehow it develops. You just don't know how yet, or where it comes from, or why. So nothing to do with the parents at all. So what is it like with parents that have the Dravet syndrome? Not parents, but people that have Dravet syndrome growing up with it. I'm sure there's some of you have had it out there, or I'm sure you still have it, obviously. As you can see, I got 57 minutes, 35 seconds left on here, so I'll try not to make this terribly long. Well, it's going to be long anyways, but. So seizures generally start with the first year of life. The first seizure often happens with a fever and maybe a tonic-clonic seizure, or a seizure involving clonic jerky movements on one side of the body, I myself have epilepsy, but I have nocturnal seizures. By the way, I know you guys, I did last thing, I was doing a 48-hour ambulatory thing on me, and they found a bunch of different, they found maybe some like seizure-like things in me and stuff like that, but they want to do further testing on me and admit me to the hospital for a few days. I'm not sure how many haven't been called back yet, so we'll probably get called back Monday here. So, of course, that's scary because they're going to take me off my seizure med. So, because obviously they want to invoke a seizure to see what happens, what's causing it to do it, and so forth. Okay, so these seizures are often long, lasting more than 5 minutes, and can result in status epilepticus. epilepticus, when seizures do not stop or occur close together. Such seizures typically recur every few weeks in infancy and early childhood. And then other seizures seen and shown with Dravet syndrome include myoclonic seizures. Based like a brief shock like jerks of muscle or group of muscles starting between 1 and 5 years in 85% of children with Dravet syndrome. So we have the tonic-clonic seizures, atypical absent seizures. They're absent, they're off, they don't know what's going on or anything. Atonic seizures. Focal aware or impaired awareness seizures, previously called partial seizures. A focal aware, they're aware, but they're not sure what else is going on, or impaired, and not quite what's going on. Tonic seizures, mainly in sleep, may appear in later childhood. So like me, nocturnal seizures that I have occurred in my sleep, I sleeping or upon awakening and stuff. Then there's non-convulsive status epileptics. I can never get that word right. Non-convulsive status epilepticus, where the child has decreased responsiveness associated with eye flutter. Eye flutter, and their eyes are fluttering, and twitching of the body for prolonged periods of time. So after the first febrile seizures can happen without a fever. So there's no fever or anything. But however, these children are very sensitive to infections and frequently have seizures when they are ill or have a fever. So if they're sick or anything like that, and it's gone on a day, or if they have a fever of some type, so very sensitive to infections. So the seizures can also be triggered by slight changes in the body temperature that are not caused by infection. For example, warm or hot bath water or hot water. So be aware of your children. So make sure they're keeping dehydrated, keeping them cool. If it's too hot to go outside, don't take them outside at all. And then a lot of children have photosensitive seizures triggered by flashing lights, patterns, or similar photic triggers. Flashing lights, bright lights, things like this. Sometimes just like a police car, for example. Emotional stress or excitement can also trigger seizures in some children. Children usually do out normally in the early years. After age 2, they may lose developmental milestones, yet they often do not progress as quickly as they get older. Other problems that may be seen include low motor tone, unsteady walking. Older children and adults may develop a crouch gait way of walking. Growth and nutritional problems. Problems with the autonomic. I'm just having gotten 1,000 today. Problems with the autonomic nervous system, which serves involuntary body functions like the heart, lungs, stomach, and intestines, which are very important, obviously, for everybody to run to work completely together, right? Of course, always be prepared when a seizure happens. So there are classes that you can take for a seizure preparedness and stuff like that, and there's even videos and stuff you can watch. And I highly do suggest that you take a CPR and first aid class. Not just for seizures, but just for anything in general. So, who gets it? Some reports suggest 1 in 20,000 to 1 in 40,000 people have Dravet syndrome. 3 to 8% of children who have their first seizure by 12 months old may have Dravet syndrome. So, it's something to take in consideration of, if you see something like that, think about the Dravet syndrome possibly, But of course, have it checked out by a doctor, neurologist, or whatever, pediatrician, and go get recommendations from them what you need to do from there. So seizures lasting more than 10 minutes, seizures occurring on one side of the body, and seizures triggered by a warm water bath in children 12 months old are clues for a Dravet syndrome diagnosis. So let's say you're taking your child, giving them a bath, whatever, all of a sudden just starting to have a seizure, and you're like, oh my God, what do I do? Well, what you're going to do is take the child out of the water, basically, get them to a flat surface, get them comfortable, to a safe spot where they're not going to make their heads on anything, And they say most clients and I'm not sure about children, but most put them on their left-hand side and stuff like that, just in case they are going to throw up something or water and stuff. And also so they're not biting their tongue so much, because like this, and they're rather not hurting their tongue so much, I believe. So the most common gene mutation linked to Dravet syndrome is in the gene called SCN1A, which I have no idea what that stands for. So I do apologize. When this gene isn't working properly, sodium channels in the brain, which help brain cells function, do not work correctly. So some SCN1A mutations associated with less severe forms of epilepsy. All right, so it can be epilepsy possibly, which means that all children with these mutations will develop Dravet syndrome. So that's another thing about is epilepsy. All right, as I mentioned, some other videos, epilepsy and seizures are two different things. You know, even though there are seizures associated with epilepsy, yes, there are sometimes just seizure disorders just in general themselves. So, rarely atypical Dravet syndrome may be associated with other genetic mutations such as SCN1B, GABRG2, or HCN1. All right. As I mentioned, I have no idea what those mean because I'm not a professional. I'm just labeling them off here. You guys can look them up on Google yourself if you like and check it out. All right. You can look on epilepsy.com. I might show you what that is. While the clinical presentation may be similar, or some patients with a typical Dravet syndrome may require alternate paths of treatment. So a blood test. Blood tests can do quite a bit for mutation can confirm the diagnosis. You know what the gene is there a gene in their blood that's mutated? There are so many genes in your body, it's just ridiculous. Sometimes a gene mutation is not found on testing, but the syndrome may be diagnosed based on symptoms. All right, so it's like epilepsy. Epilepsy can be based on symptoms and stuff, just by talking to your doctors and greasy hair. So, but anyways, I don't know how to do that, but anyways, it doesn't matter. A blood test for the mutation confirmed the diagnosis. Sometimes a gene mutation is not found on testing, but the syndrome may be diagnosed based on symptoms. Although the first seizure and evidence with Dravet syndrome may be near the time of a vaccine, vaccines do not cause Dravet syndrome. Not that we know of anyways, right? We're not for sure nowadays since then, because this is before COVID and all that stuff. This is talking about from 1989 and stuff. I'm not sure how current this is. Children should get recommended immunizations. So, then down here, understanding genetics can help you and understand Dravet syndrome. And it says start here, so you can go to genetics, the basics, genetic counseling, genetic testing, genetic resources. You can look up those stuff too. So how is it treated? Well, diagnosing the child early is critical to proper treatment and achieving the best outcome. A multidisciplinary team is needed to address the many ways Dravet syndrome can affect a child and their family. So a seizure treatment is aimed at finding the best combination of medicines to treat chronic seizures. Rescue medicines are also needed to prevent and treat seizure emergencies. Like myself, I have a rescue med, which is called Hazelin, which is supposed to, it's a benzodiazepine, which you spray in my nose and it's supposed to stop the seizure. And that does work. My wife used it on me and it scared her, of course. But getting the best seizure control possible is the goal. However, complete seizure freedom is usually not achieved. And as I mentioned in the beginning here, Dravet syndrome is a lifelong. You live with until your time. So getting the best seizure control possible could also help improve a child's developmental abilities and decrease risk of early death. All right. So often it does sound like it could have an earlier death than normal time of average, which is scary. So usually 2 or more seizure medications are needed to treat the multiple seizure types with this syndrome. Alright guys, I'm back. So the idea for the Dravet syndrome is to get the best seizure control possible as well. However, complete seizure freedom is usually not achieved. Remember, Dravet syndrome is lifelong. So usually 2 or more seizure medications are needed to treat the multiple seizure types with this syndrome. Medications commonly used for Dravet syndrome include valproic acid, which most of you probably heard of, and so used for other things too, clobazam, topiramate, serotypin, phenethylamine, and cannabidiol, cannabis basically. And also the ketogenic diet is also frequently used, which that's a very hard diet to follow. Very, very hard diet from what I understand. The U.S. Food and Drug Administration, we'll just call it FDA, has recently approved 3 specific medications for use in children with drug-resistant seizures due to Dravet syndrome. A purified oral solution from Cannabidiol, which CBD, are part of the cannabis plant, called Epidiolex, was approved in June 2018. In a study of 120 children and teens with Dravet syndrome, 43% of those treated with Epidiolex had greater than 50% decrease in seizures compared to 20% of those treated with a placebo. But not too bad. Side effects, though, seen more often in people taking CBD include diarrhea, vomiting, fatigue, fever, even as abnormal results on liver function tests. So it sounds like it can affect your liver. And stirapentol, or diaclomet, was also approved in August 2018 and should be used together with clobazam. 71% of children treated with the stirapentol had a greater than 50% decrease in seizures, compared to only 5% treated with placebo. Side effects of stirapentol include sedation, decreased appetite, fatigue, and weight loss. Then you got fentanyl, or phenethylamine, was approved in June 2020 for use in children with Dravet syndrome, greater than age 2 years. In randomized clinical trials, when used without stirapentol, the average seizure frequency decreased by 74.9% in person with Dravet syndrome. So it's getting better, obviously. Received a higher dose of fentanyl, compared to only 19.2% in those receiving placebo when used with stirapentol. Patients were treated with fentanyl, 0.4 kilograms, or decis, to a maximum dose of 17 milligrams a day, achieved a 54% greater reduction in convulsive seizures than those receiving the placebo. Common side effects included sedation, insomnia, weight loss. So, obviously, well, I guess it's a good thing if you're heavy on the heavy side and lose weight loss, but that's not always good at all. To lose weight, losing weight, real easy. Fentanyl is available through a restricted program called the Fentanyl REMS program, where patients are required to enroll in this program in order to be evaluated for baseline echocardiograms and follow-up echocardiograms to look for changes to their heart valves, if any, with the use of fentanyl. No critical/clinical actionable changes were noted in the studies. So there may be nothing affecting their hearts or anything like that for the young children especially. So it's important to avoid medications called sodium channel blockers, as these can worsen seizures and Dravet syndrome. These include phenytoin, dilantin, so phosphatoin, Cerebix, pododilantin, carbamazepine, Tegretol, oxcarbazepine, Trilipto, lamotrigine, Lamictal, and rufinamide are benzo. Additionally, the medications vigabatrin, Cibril, and tigaben, or Gabatril. And please forgive me because I cannot pronounce these words that well. I do apologize. So Lamictal, I'm just going to say the generics. Lamictal, benzo, Cibril, Gabatril may increase the frequencies of myoclonic seizures and should be avoided. A recent study showed that development outcomes were worse in children who have been treated with the sodium channel agents for longer periods of time. A ketogenic diet has been helpful in some people with Dravet syndrome. Surgery is not indicated in most people with Dravet syndrome, although vagus nerve stimulation may be useful in some children. And you can go back a couple more videos and talk about the vagus nerve stimulation. So, all people with Dravet syndrome should have a rescue medication. Additionally, all children and adults should have a seizure action plan. So like I said, there's classes that they can take on, help with information, what you should do in case of emergencies of that. Get your child or whoever to a safe spot away from anything where they can hurt themselves or injure themselves or anything like that. Have an action plan in place, what you need to do, and have their rescue medication nearby if you need to administer that. A child with Dravet syndrome should undergo a development assessment prior to starting school, because they're going to be developmentally delayed, and like they said in here, that they're going to have a crouched walk and so forth. Physical, occupational, speech, and social play therapies are also helpful, and a rich environmental is encouraged. And so, what's the outlook? Well, while seizures severity and number can be reduced with appropriate therapy, complete seizure freedom is typically not reached. So, as they said in the article here, that it's a lifelong term, unfortunately. It's going to be throughout their life. I wasn't sure the outcome or what the average age is that the people with the Dravet syndrome live to, but it's hard to say. They can live a normal life, it seems like, for the most part, except for, of course, the seizures. Other health problems need to be identified and treated early. These also affect a child's development and outlook for the future. Then we have people with Dravet syndrome have a higher rate of SUDEP, which is sudden unexpected death in epilepsy, which a lot of people with epilepsy know about that. Other causes of mortality associated with Dravet syndrome include consequences of status epilepticus, and accidental death from injury or drowning. So basically, no swimming. You know, I mean, I guess they can learn and swim stuff, but they probably shouldn't go anywhere in the water. Well, maybe wade, that's about it. Fentanyl is now available through the REMS program, to which patients have to enroll. While phenethylamine has been associated with heart valve thickening in the past, no cardiac problems have been found so far in the clinical trials. While the diagnosis and consequences of Dravet syndrome can be catastrophic, the cause is known. Ideally, more research can be targeted to improve treatment and find a cure. So there's a lot of stuff about that, unfortunately. And I'll share the article and stuff, and I'll put in the I'll put in my description here. So if you guys want to, you can go to the epilepsy.com. Just type in Dravet syndrome in their search bar, and it'll bring up all kinds of different stuff about it. And that's crazy. So I'm gonna look up and see how long people live. How long do people live with Dravet syndrome? I'm trying to find the average and see. So, what it says, this is an AI overview. It says, while Dravet syndrome is a lifelong condition, many individuals with Dravet syndrome live into adulthood, with some reaching their 60s. However, a significant percent age, 50, I'm not trying to scare nobody. However, a significant percent age, 50 to 20%, do not survive beyond childhood or adolescence, often due to complications like SUDEP, which has been sudden unexpected death in epilepsy, or status epilepticus. The mean age of death in those who don't survive to adulthood is around 8.7 years, with most deaths occurring before the age of 10. All right, that's before the age of 10. Doesn't mean you can't have a normal childhood and live into adulthood. This study suggests that approximately 80 to 80% of children with Dravet syndrome survive into adulthood. Okay, a substantial portion, 15 to 20% of individuals with Dravet syndrome do not live past childhood or adolescence, according to the Dravet Syndrome Foundation, and also because of SUDEP. So that's a scary thing. Well, this is my brain wreck. Thank you for watching. I'll try to bring some more episodes here on my vlog, whatever, and pass on more information for you. Yes, you guys can look on the information yourself. I just like to doing this for myself, just to get stuff out there in case you're unaware of what Dravet syndrome is. And yes, some of you guys know that, and a lot of you that have had epilepsy for a long time, or for those that have Dravet syndrome, leave a comment in here and let me know what you think about it, or if you know anybody that has it. Thanks for watching my brain wreck. You guys have a great night to each and every one of you.